Hello, and thank you for joining us. Today we'll be talking about the impact of communication between providers and veterans on relationships, treatment, satisfaction, and provider outcomes. Several times throughout the video, your training leader will be asked to pause the video to lead a discussion. When this happens, you'll see an image that looks like this.
You'll be then asked to engage in a discussion about the way in which the concepts presented in the video relate to your clinic and your specific practice. Let's get started.
Health literacy is the degree to which individuals can obtain, process, understand, and communicate about health-related information needed to make informed health decisions. Health literacy and overall literacy are related, but they're not the same. You can be highly literate, but still have limited health literacy. In 2003, the National Assessment of Adult Literacy was completed. 19,000 American adults were surveyed and placed into one of 4 levels of general and health literacy skills based on their ability to read, understand, and interpret text and numbers. 36% of adults surveyed, which corresponds to about 78 million Americans, scored at the 2 lowest skill levels. That means that over 1/3 of people surveyed had difficulty doing things like circling an appointment date on an appointment slip, identifying what things were okay to eat and drink when given instructions, and explaining information on disease prevention when the information had been presented to them in a pamphlet. An additional 3%, which corresponds to about 11 million Americans, could not even be assessed in the survey because of their literacy skills. So what does this have to do with veterans? There are a couple of pieces of information that indicate that this is an important issue. One is that people who have lower health literacy tend to be older, have a lower socioeconomic status, have prior negative experiences with healthcare services, and have complex medical issues. This could be true of veterans that we may see at the VA. Another piece of information is the research on health understanding that's been done at VAs. In 2013, a paper was published that suggested that more than half of veterans do not have adequate understanding of health information. This means that it is more likely than not that someone that you are working with does not have adequate health literacy to understand the information you are giving them. Why does this concern us? Well, most providers operate at a different level of health communication. We tend to be proficient at understanding health information, and that's the language we speak. The problem pops up when we start to have trouble translating our language so that our veterans can both understand and participate in their own health care.
Do we need to translate our health information so that those who are not proficient can understand it? Well, let's talk about what happens when veterans have limited health literacy. Veterans often stay silent when they have difficulty understanding health information. This can lead to feelings of shame, avoidance, fear, anxiety, and low self-esteem. People with low health literacy also tend to have less health knowledge, including poor knowledge of disease and diminished involvement in shared decision-making. They often engage in risky health behaviors and are more likely to smoke, be exposed to violence, and have less access to routine and follow-up pediatric health care. General health outcomes also vary in people with lower health literacy. We see lower adherence to treatment regimens, poor functional status, worse clinical outcomes, and increased overall mortality. It also costs more. People with low health literacy have higher healthcare utilization, increased rates of hospitalization, and less use of preventative services. In general, research suggests that providers may overestimate the level of their veterans' health literacy, inadvertently discourage collaboration between themselves and veterans, and miscommunicate or fail to communicate important health information.
So what can we do? Luckily, there has been significant research on the positive impact of improving communication between providers and patients. An effective response to low health literacy in the general veteran population is strong provider communication. Providers with objectively strong communication skills have veterans with better medical and mental health outcomes. Strong provider-patient communication leads to stronger relationships, decreased anxiety in veterans, increased feelings of being understood, and better adherence to medications.
Not only are patient outcomes improved, but these providers have fewer malpractice suits filed, fewer formal complaints lodged against them, greater job satisfaction, and reduced burnout.
Improving veteran-provider communication can be a way to bridge the health literacy gap between providers and patients, improve veteran mental health outcomes, and increase provider satisfaction.
Effective communication between providers and patients is clearly an important component of a good patient-provider relationship, a strong predictor of positive mental health outcomes for patients and positive career outcomes for providers, and cost-effective for hospitals and medical centers.
Though we learned before that it's likely that you will need to be mindful of your language at all times, we do have some examples of behaviors to look for that suggest you may need to spend some extra time with a veteran.
That's right. Red flags include such behaviors as failing to complete a form, frequently missing appointments, failing to follow up on recommendations from providers, or failing to follow through on lab tests. Though we often chalk this up to non-adherence or non-compliance, it is possible that there is a communication problem.
Red flags also include responses to requests for information, such as,
"Can I fill this out at home? I forgot my glasses." "I forgot my glasses. Can you read this to me?" "Let me bring this home so I can discuss it with my children."
Other red flags to look for that might indicate issues with understanding health information include being unable to name their medications, being unable to explain what their medicine is for, and describing medicines to you as the yellow one or the big pill.
As we discussed earlier, it is more likely than not that improving communication will improve patient and provider outcomes. With the VA's emphasis on recovery-oriented, veteran-centered care, we need to be sure that we are involving our veterans in their own care so that they feel competent and effective. A great way to do that is to communicate to them in their language. Remember earlier when our veterans were having difficulty remembering the name of their medication? That's a great time to start using a medication chart where you draw a picture of their medicine and go ahead and put the name on there. That way, you have the veteran's way of remembering it, along with a real name in case that's necessary.
We also suggest that you write down the most important information in large writing. The key is to emphasize the most important information and not to overwhelm with the rest of it. Here's an example of a provider working with a veteran to ensure that she takes her medication the way it's prescribed.
"Well, I take the big yellow one 3 times a day and the little white one once a day, so I just take them all in the morning because otherwise I'll definitely forget."
Well, I can see why you might do that. However, it's important to take these medicines at different times so that it's working all day. Would it be helpful if we wrote out a chart to help you remember?
That would be great.
Another way to work toward improving communication is to be mindful of the words we choose to communicate important information. Let's use an example from law related to medicine to illustrate this.
In a suit against a physician or healthcare provider involving a healthcare liability claim that is based on the failure of the physician or healthcare provider to disclose or adequately disclose the risks and hazards involved in the medical care or surgical procedure rendered by the physician or healthcare provider, the only theory on which recovery may be obtained is that of negligence in failing to disclose the risks or hazards that could have influenced a reasonable person in making a decision to give or withhold consent.
How do you feel in reaction to that? How about when she says it like this?
In a lawsuit against a physician or healthcare provider where the patient is arguing that they were not fully informed about the risks of the procedure, the only way the patient will win the suit is if whatever was not disclosed may have influenced any reasonable person's decision of whether or not to consent.
Now this might be really important information for you. Some simple switches to start making that we know have an impact on veterans feeling like they're part of the appointment include asking a veteran, "What questions do you have?" rather than, "Do you have any questions?" There are also plenty of words that we use on a regular basis that would work just as well if we swapped in some plain language alternatives.
A really important part of being an effective clinician is knowing enough about your specialty to know when it's okay to paraphrase, like you just discussed, and when it's good to define an important term for your veteran. Terms like names of diseases or disorders, names of treatments, types of labs you are requesting, and others may be important for the veteran to know going forward so that he or she can share this with other providers or engage in self-education after the appointment. As we discussed before, it may be important to write the name down for them, as well as describe what it means for them in plain language.
A tried and true way to ensure that your veteran is leaving with the information you intended to convey is called the teach-back method. Using this method, rather than asking whether the veteran understands the information they've been given, you ask them to teach it to you. Let's watch an example.
The plan is for you to take 5 milligrams or 1 pill for 3 days, 10 milligrams or 2 pills for 3 days, and then 15 milligrams or 3 pills after that. Can you explain that back to me?
Okay, so I'm supposed to take 1 pill for 3 days, 2 pills for 3 days, and then 3 pills for 3 days.
Almost right, but I need you to keep taking 3 pills until I see you again. Would it be easier if I wrote that down?
I think I got it. So it's 1 pill for 3 days, 2 pills for 3 days, and then 3 pills until I see you next. I would like it if you wrote it down anyway.
Let's bring it all together. Watch this provider and veteran talk together. After, talk with your colleagues about potential red flags and communication issues you saw.
Well, how are you today?
I'm doing fine, thank you.
I notice here that you didn't finish up your paperwork.
Oh, yeah, I forgot my glasses at home. Would you mind reading it to me and filling it in?
Sure, we'll have the nurse come in and finish that up when we're done here.
Thank you.
Okay, so we got the results from your strep culture back, and they were positive.
Oh, good.
We do need you to set you up with some antibiotics and some analgesics for the pain, and you will be contagious for the next couple of days.
All right.
We have some samples here that I've brought. You don't even need to go to the pharmacy. This one here is amoxicillin. Take these 3 times a day for 14 days, but never on an empty stomach. You have to finish these even if the pain alleviates. You can't just stop taking them.
Okay. Small and white.
Yes, that's right. And this one here is ibuprofen. You can take these if the pain bothers you, but don't mix these up.
Okay. Little and red.
Yes, yes. Okay, and you're on oral contraception, right?
No, I don't think so.
Okay, because if you were, it would be affected by the antibiotics. So you'd need a backup prophylactic for the next couple of weeks. Do you understand?
Sounds good.
Okay, all right, feel better.
Now, let's watch this veteran and another provider communicate with one another. Keep track of the improvements you see so that you can discuss after.
So how are you doing today, Ms. Smith?
I'm fine, thanks.
Well, your test results came back, and unfortunately you do have strep throat. Tell me what you know about strep throat.
It's a sore throat, maybe like having a cold?
Yes, it's sort of like a cold, but it does last a little longer, and you're going to need to take some medicines that I'll give you. It's caused by germs we call bacteria, and it makes your throat sore, like you mentioned, plus other symptoms such as fever and stomach ache. You can catch it from others as well as give it to others, so it's important to wash your hands frequently and to have some tissues handy for when you need to cough or sneeze. What questions do you have for me?
How long will I have it? I need to get back to work.
Strep throat will go away in about 3 to 7 days. And I recommend you don't go to work until then because you can give it to others. But I'm going to give you 2 medicines to help you feel better. Would it help if I wrote it down?
Yes, but I usually just go by the color of the pill.
Okay, that's fine. The first one is an antibiotic. It's called amoxicillin, so it starts with an A and it's blue. Remember how I said that strep throat is caused by germs? Well, this will help get rid of the germs. You need to take it 3 times a day with meals for about 2 weeks until it's finished, until it's done. So I'm going to chart it for you. You'll keep doing this until the bottle is empty. So why don't you walk me through the times you'll be taking your medicine?
Okay, so I take it in the morning with breakfast, again with lunch at noon, and then at dinner. And I do this until there are no more pills left.
Right. The other medicine I'm going to give you is for the pain you're having. It's called ibuprofen, and it starts with an I, and it's small and red. It's very important that you don't get these 2 mixed up. So let's draw it down here so you remember what you're supposed to take. Now you can take this medicine when the pain bothers you. So for instance, right now, on a scale of 0 to 10, how bad is the pain you're feeling from being sick?
It's about a 6, but when I go to bed, it's usually worse.
Okay. So when you feel like it might be between a 6 and a 10, you can take one of these pills for the pain. Starts with an I, ibuprofen. So here on the chart, let's write down next to the pill that you only need to take it when your pain is getting bad. You should only really take these when you need it, and you shouldn't take more than about 4 in a day. So what do you know about these 2 medicines?
Okay, so I take this one 3 times a day with meals, and this one when the pain gets bad.
Exactly. One more important thing I want to discuss. The antibiotic, the first medicine we discussed, can affect your birth control pills that you take, making it less likely to work.
Oh, that's not good.
Well, you have some options. To prevent pregnancy, if you are going to have sex, make sure to use a condom.
Okay.
So what questions do you have for me now?
I don't have any, thank you.
Feel better, Miss Smith?
Thank you so much for participating in our training today. We hope that you've been able to learn about the importance of strong communication and also to learn some easy to implement skills. The work that you do is so important and so valuable, and we hope we've given you some ways to reach as many people as possible.
Here are some questions to think about going forward.